So we are seeing an increasing amount of information on testing lung cancer to find out if it has a mutation. Can you tell us a bit more about what that means and how these tests are carried out?
So looking at the lung cancer specimen to find out whether a tumour has a particular mutation is really important. There are an increasing number of cancers which do have a mutation that can be treated with a particular drug successfully, at least in terms of controlling the disease for an appreciable amount of time. And so sometimes that's called a druggable mutation, a mutation which has a drug target. And it is an ever-expanding field. So mutations which exist now there may be drugs available which weren't available, say, 2, 5, or 10 years ago. Generally speaking, when a tumour has a mutation, the treatment is directed specifically at that mutation. And again, generally speaking, the treatment is usually quite effective in controlling the disease, perhaps not curing it, but controlling it for some time.
And in terms of testing and finding out about genetic mutations, is that part of the normal process when somebody has a lung cancer diagnosis? And can it happen quite quickly, or might it delay treatment decisions?
So testing for mutations does take extra time. For people whose primary treatment will be dependent on that, for instance, people who don't have cancers which are operable, then it is important, if at all possible, and it usually is the case, to wait for the results of the mutation testing to come through. Now, that can be very frustrating because you want to get on with the treatment as soon as you possibly can. But generally speaking, it takes about 10 to 14 days after the biopsy for the results of the mutation to come through. It will vary from place to place. Some may be longer, some may be shorter.